Welcome, everyone. Thank you so much for joining us on this beautiful South Florida evening for this virtual UMiami Health Talk, Survivorship, focusing on the journey. I'm health journalist Ileana Bravo. I'll be your moderator for tonight's talk, presented by Sylvester Comprehensive Cancer Center. I think you should know that Sylvester is South Florida's only NCI-designated and nationally ranked cancer center, and our community's only university-based comprehensive cancer center. It's home to an expert team of more than 2,400 physicians, researchers, and staff who work together to discover, develop, and deliver world-class cancer care. Their experts offer a wide range of programs to help our community make lifestyle choices that reduce risks and promote well-being. To learn more about Sylvester's services, please go to sylvester.org/survivorship. To make an appointment with one of our cancer experts, please call 1-844-324-HOPE. HOPE is 4673. Well, folks, tonight we have the privilege of hearing from two highly esteemed Sylvester cancer experts, Dr. Carmen Calfa and Dr. Tracy Crane. They're going to cover a variety of key topics related to the cancer survivorship journey, 2022 trends in cancer statistics and survival rates, common side effects related to cancer treatment, and so much more. And we will remind you that there's going to be a question and answer session at the end of the presentation. Now, many of you have already submitted questions in advance, but don't worry, you can enter them as we go using the anonymous Q&A feature at the bottom of your Zoom screen. Take a look at your computer, whatever device you're on, and locate that so you're prepared. And we will prepare as many of your questions for our experts to address at the end of the presentation. So let's begin with our panelists, and my pleasure to introduce Dr. Carmen Calfa, a breast medical oncologist at the Bremen Family Breast Cancer Institute and an assistant professor of clinical medicine at the University of Miami Miller School of Medicine. Dr. Calfa is also associate director of community outreach and medical co-director of clinical operations for the Survivorship Cancer Program at Sylvester Comprehensive Cancer Center. Now, she's been recognized for her clinical care and research and has received the prestigious Zubrod 2020 Outstanding Clinical Researcher of the Year Award. And also recognized for her work in the community, she's the recipient of the 2020 Miami Dolphins Everyday Hero Award. Dr. Calfa works as part of a multidisciplinary team of breast cancer experts and researchers that focuses on breast cancer prevention, treatment, and survivorship. All of that brilliant CV to help me welcome Dr. Calfa. Take it away, Doctor.
Thank you so much. Thank you so much, everyone, for joining us. And Ilana, it's always so nice to be able to share, the evening with you and the amazing Dr. Tracy Crane and the team behind, which made our life really easy to put this great presentation together tonight. I will start by giving you this little insight of what a survivor story sounds like, and this motivates me every day when I come to work. I think many of you probably know me. I'm a breast medical oncologist. I treat patients with breast cancer, and I focus on not only the breast cancer, but also the risk reduction, risk prevention. And then once somebody is diagnosed with cancer, just making sure that they have the best survivorship they can have. I'm privileged, as you learned from Ilana, to work with really a great group of people to really develop something that I think we're unique in what we have and really special in terms of survivorship. So I'll take you through that quickly, and then I'll pass it down to Dr. Crane, and you'll hear from the two of us, the things that the cancer does, the cancer treatment does, but also the things that we can do about really embrace ourselves, embrace the new ourselves, and then to really make the most from the journey. So focusing on the journey, I just want to say that the story of the cancer isn't the story of the doctors who struggle and survive moving from one institution to another. And I know many of you have changed doctors. It's the story of a patient or patients who struggle and survive moving from one embankment of illness to another. Resiliency, inventiveness, and survivorship are qualities often ascribed to great physicians, but they're reflective qualities emanating first from those who struggle with illness. And this is a great book. If you haven't read it, it's The Emperor of All Maladies, written by a physician. So this inspired me to really keep being grounded on what is really important when I come and do what I really love to do, taking care of my patients and their families. So as you know, and as you hear every day on the news, and I'll focus to some extent to the breast cancer, but I'll also touch base on the rest of the cancers. Many of the cancers are on the rise when it comes to how many people around you're gonna hear that have a diagnosis of cancer. 1 every 2 minutes get diagnosed with breast cancer. But with that, the number of survivors is growing because we are able to do early detection and better treatments, and we're seeing the patient population aging. So when you look at this graph, it just shows you where we were in number of survivors in 75 with the 3.6 million and how nicely that number of survivors is growing, with an expected 26 million survivors in 2040 and currently about 17 million survivors. So when you look at the age distribution, more than half of them are 65 or older. And that comes with a lot of challenges. It comes with the challenges that are brought on by the age, the chronic and debilitating symptoms, the comorbidities, the fact that doctors are really working really hard, but it's at times overwhelming, and there are fewer and fewer that are keeping up with the demands. And I think there is a clear shortage in terms of primary care physicians and oncologists. And I just saw that Florida is really short in oncologists. And then there is inconsistent prevention and care fragmentation. So when you look at the Sylvester team, I think it's going to give you a good insight of what we're doing here. So we have Dr. Frank Pinedo, who's a psychologist, and he's the program director of the Cancer Survivorship and Translational and Behavioral Science at Sylvester. And then you see Dr. Tracy Crane, who I have the pleasure to share the night with. And then you have community engagement with Dr. Brandon Mahal, a prostate cancer specialist. Then you have me on the right with Dr. Matthew Schlumbrecht, who's the co-medical director and doing gynecology oncology, and Jessica McIntyre, who's a nurse practitioner and helping us at the executive directorship level. So with all that is because we really try to make this survivorship program not only to just focus on symptoms management at the time the cancer happened or the cancer treatment, but really look at the deeper aspect of it and really build a program that starts at the cancer control program to the community outreach and then to cancer support and services for our patients. And all that to really have the goal of improving patient experience and outcomes. So survivorship is the definition that includes a person that was diagnosed with cancer from day one of the diagnosis. And I joke about it and not joke, but I say if you survive the day of diagnosis, then you're a survivor. And that goes and stays with you as long as you're alive. And beautifully enough, it's including the caregivers and the family members according to the last NCI definition, which I think is the right thing to do. And when you look at survivorship, many patients ask, well, how do I know I'm a survivor? When does that start? And it does start on the day of diagnosis, but it has different phases. So it has the acute phase when you really get the diagnosis and you have the initial treatment. But then it goes into the transitional and extended survivorship, which really spans the months and the years following the initial treatment. Some patients are on maintenance therapy, like breast cancer patients for 10 years, taking a pill. And then there is the permanent or the long-term survivorship. And I really like the fact that patients with advanced cancer are definitely included in the survivorship group. And those are the patients that live with cancer and they try to manage it as good as they can as a chronic condition. And at that time, there is also the risk of having another cancer, either related to the treatment or just because you're alive and growing older. So we really care about this journey and make it about the patient experience and really make it patient-centered and use technology to really help reach the patient where she or he is, and then really develop the survivorship care in a very individualized and precise way. So when you look at this nice slide, it just shows you that the survivorship starts at diagnosis, and then it goes through the different phases with us at Sylvester, really employing different techniques and innovative services, including IT and development of softwares that are able to help us to capture the patient's symptoms live as they happen, and then to really develop specialized care clinics that are able to see the patients for the specific needs, and then really help coordination of care with the primary care providers and other physicians involved. So what are the challenges? Well, this nice graph, which I'm going to take you through it completely here, it's showing the challenges, not only the physical, but the psychosocial from the time of diagnosis to the treatment planning, to the neoadjuvant or treatment that you receive initially, and then follow-up for late and long-term outcomes. So as you can see at different phases of survivorship, the challenges are different, but they're never to be underestimated. And they're usually underdiagnosed and undertreated. So you see at the time of diagnosis, when you feel like your life is upside down, there is uncertainty, anxiety, depression. There's so much that is happening. And then you go and you see the doctor, and you potentially have a second or a third opinion. Hopefully you come to see us at Sylvester. But we have this information overload that patients share with us about. And then there is a decision-making process that is really, really hard, and it takes a lot to make it right. And then you go on, you take the treatment, and then all these side effects from the treatment and the cancer and the psychosocial all happen at the same time. So it feels like it's really something that strikes individuals and their families, and it's something that is happening and is there to stay. And as you go on through the treatments, then you have the late effects and you have the long-term outcomes. So all these things are complicated by how many comorbidities one individual has, and what's the disease stage and severity, and where they live and what zip code they live. How much disparity we have in cancer care, and that's what their lifestyles are. So I developed this because I think, it just shows and illustrates the survivorship as the gift that keeps on giving, as I call it, and something that affects the individual from literally head to toe. And as you can see in the middle of the circle, I just depicted the most important, the most common side effects that are coming with treatment, and with either the treatment or the cancer itself. And you can see from this unisex little depiction of an individual that shows somebody bald with alopecia, not all cancer treatments cause that, but many do, to all the way to cognitive dysfunction, depression, lymphedema, cardiotoxicity, and going around, it really affects almost every part of the body. If it's not from outside, from inside for sure. And then outside, I call this the circle of friends. These are all the services that we put together at Sylvester in the specialized clinics I told you about, to really counteract the things that the cancer did or the cancer treatment did. So I'll take you quickly through the main side effects that are really listed there for you to see. And they're really here concentrated in 3 pages from the New England Journal of Medicine article, which is the most reputable one, and it's the most recent review. And it's not cancer specific. It's really it's not the type of cancer that dictates this, but it's rather a common denominator for all cancers and cancer treatments. And it goes, like I showed on the previous one, from really the psychosocial to the physical. But on the frequency, you can see that these are all common. On the right side, you see the interventions. And I'm going to point out that there is something that really helps, and almost every one of the side effects has a common intervention that can help. So there is depression, anxiety, post-traumatic stress disorder. 80% of the patients with breast cancer have PTSD. The fear of recurrence, about 80% as well, depends on what studies you read. Issues concerning return to work. And then you have the long-term and the late terms, the late effects of treatment. You have the chronic pains that are either related to treatment, the surgery that you had. If somebody's on hormonal treatment, they get all these arthralgias and myalgias, and they have to live with them for several years, sometimes 10. There is infertility that affects women and men going through cancer treatment, and now there's so much we can do. We actually have fertility preservation and a full service at Sylvester. We have the chemotherapy-induced neuropathy, which is really hard to counteract once an individual is affected by that. There's some drugs, but there is also acupuncture and other interventions I'll share with you in a second. And then you have the rest of them that you can still see they are common. So you see how this is the gift that keeps on giving. These are long-term toxicities that are there to stay. And in our mission at Sylvester, we really want to make sure we acknowledge all these possibilities, and not only that we acknowledge and we say, hey, be happy you're a survivor, this is a new norm. We just don't want to accept that, and we want to really tackle every single one of these toxicities and develop a program around it. So our survivors and their families and caregivers are really best served by us at Sylvester. There is fatigue that comes with either the cancer or the chemotherapy or the endocrine treatment or the bone marrow transplantation. There is insomnia. How many patients come and tell me that they have insomnia? When you look, what can you use? You can use the melatonin, you can use the sedatives, the hypnotics, their medication, but there is also lifestyle intervention and cognitive behavior therapy. Sexual dysfunction, we have a program that we put in place. It's called Music for the Sexual Dysfunction. Metabolic syndrome, people usually gain weight, no matter if they think they're going to lose, they still gain. There's bone loss with osteopenia, osteoporosis. There's cognitive dysfunction, like we talk about. There is the chemo brain. Even if you're not on chemotherapy, if you're just receiving endocrine treatment, patients feel this fogginess and inability to function at their highest acuity that they have. So that's a cognitive dysfunction that we're putting a program for. Then you have these effects of the treatments on the heart. And there is now a field called cardio-oncology where the heart side effects are recognized, and we developed strict guidelines on how to really not only take care of the cancer, but keep in mind that the heart can get damaged as you cure the cancer, as you treat the cancer. And we have specialists that are able to be proactive and help us along the way so the patient doesn't have to face that long-term toxicity. The valves of the heart can be affected when you receive radiation to the chest, the left side, or other radiation for lymphoma, for instance. And then there is the late effects that you can see here, where even with tamoxifen taken for 5 years, there is a 1% increase in uterine cancer risk. There are myelodysplastic syndrome that people are afraid of. When you talk about receiving one chemotherapy to cure breast cancer or to hopefully cure breast cancer, you counsel patients and you say, well, that can give you a myelodysplastic syndrome or leukemia. That's always very, very scary for our patients. And we want to make sure that even though it's listed here as very rare, we choose our drugs carefully to make sure we don't overtreat just to be on the safe side, but we keep that possibility in mind because it can be life-threatening. And then we have other things that can happen, even in the radiation field. We can have very rarely sarcomas, and then sarcomas can happen de novo as well. These are very rare, and the common ones are the ones that I showed you on the previous pages. So when you look at the prevalence of the symptom burden, those that have moderate or higher severity, you can see here in the all being the red bar, and then the breast is the brown one, the colorectal cancer is the yellow, the hematological malignancies are the green, and others are the blue. The breast cancer survivors, there are about 3 million in the United States right now, with the new cases this year being about 287,000, which is on the rise. The mortality of breast cancer patients had decreased significantly. So the number is going up in terms of new cases, but the mortality has dropped about 40% in the last 3 decades. That means that our survivors are going to live to be old people and grow old together, like we say. And that's really the goal that we have. But as they grow older, look at the side effects that they have in the brown bar. The fatigue is really in 60% of the patients. And then you go in the hot flushes that are almost half of the people diagnosed with breast cancer. And then you have depression, problems, sexual problems, numbness, neuropathy, anxiety. And the rest of the cancers, the common ones are listed there as an example. But breast cancer leads not only in terms of the incidence, the prevalence, the cure rates, but also in terms of long-term toxicities and things that we have to really be mindful of. So I told you that I'm going to take you back to this graph just to show you that from everything that I told you that goes around in this circle, we actually have developed a service to take care of that problem the best way possible, not only giving you a medication or an intervention, but really leading the research in the country to make sure that not only that we can apply what we know today, but we can lead the research to make the future brighter and better, because all these symptoms are really hard to actually get rid of completely. So if you look here, you have the neuro-oncology for patients that have radiation to the brain and they live now with stage 4 breast cancer metastatic to the brain. You have the cardio-oncology, the sex therapies I told you about. We got the lifestyle and diet, and that's a favorite circle I have at the bottom of the screen. Because I told you that if you look at one intervention that commonly helps, that is going to keep on coming. And that's why we have our special guest today to really help us to make the most of using these interventions to actually get benefit in every single one of the side effects listed here around this little individual. That intervention potentially can help significantly. We have the cancer rehabilitation, the palliative care, the social worker, the exercise physiology, the genetics, and then we work close hand in hand with the psychologists and with the primary care physician and psychiatrist to really come together and really deliver a coordinated plan. So the cancer support services that we use at Sylvester are all listed here, but I wanted you to see the faces of the people behind because I think this is beautiful. You see that we provide the massage, we do music therapy with Mary right there. She has a PhD in using music for anxiety, depression, mindfulness. We have art therapy, exercise physiology, massage therapy, acupuncture, pastoral care, and physical medicine and rehabilitation. So these are all services that we put together, and we're so proud to have them all here, provided to all our patients at no additional cost. We also have a group defined just by their age, and that's the adolescent and young adult. I want everybody to know that we have a summit on October 8th at Margaritaville. That's patient diagnosed with cancer from age 15 to 39. And this is the list of the support services that I told you, proudly of. They're all there. The question of how to deliver this integrated survivorship care remains, and we are also in the front row trying to really define the best models that the patients are preferring. And, the current survivorship clinics are really looked upon as different models, either with separate survivorship clinics without the physician, just nurse practitioners. Our patients, we know that they want to see their oncologist, so we try to really make the hybrid ones where we have a shared care with our nurse practitioners. And then for those that need multiple interventions provided in the same visit, we really piloted successfully this multidisciplinary survivorship clinic at Plantation, where the patient comes and sees the physician. You see me here with my nurse practitioner and the team, and then the patient doesn't have to move from one location to another. She's just there, and all the specialists are coming and sharing their knowledge and expertise. So you can see exercise physiologist on the right side of the screen, social worker, music therapy happening virtually because of COVID, massage therapy is being given therapy being given in between. So this is our goal, to really reach the point where the patient can focus on prevention, not only to prevent the cancer from recurring, but prevent secondary cancers from happening. So we're going to help with that surveillance. We're going to help with the coordination of care with the rest of the physicians that a patient has in their life. And then we're going to intervene with all the ways that I share with you to really make the survivorship the best by managing the symptoms that impact their health and they're related to their quality of life. So those are physical, psychological, social, and spiritual. So that would mean that we reach our goal to really make our survivors thrive and be here for their loved ones and enjoy the life at the most. And this is how life as a survivor or pre-vivor looks at Sylvester. We're really proud to have all these community events and engage with the community. We do the Dolphin Cancer Challenge. You're welcome to come and walk with us, run with us, do as much as you want to do virtual or in person, and be a part of this community and just help us lead the change for all of you, so we can all learn from each other. And we're here to do everything we can. I'm here to help in any way I can, if not during the talk today, but definitely afterwards. And I really love the fact that we're getting together to share this information with our community. And I will now let Dr. Crane tell you everything you need to know of how to really grow as a really healthy survivor for you and your family. And thank you so much for being here with us tonight.
Thank you so much, Dr. Calfa. You're always a pleasure to listen to in your presentations. It's the full spectrum of services that you dish up and explain so well. And let me remind you of the more than 100 people joining us for this talk tonight, that we are looking forward to getting your questions. Remember the Q&A feature at the bottom of your Zoom screen. Make sure that you see it so that you can enter your questions. It's a very unique opportunity to reach out to two of our top experts in this field and be able to ask them for their resources and, specific questions. So now let me turn it over to our next panelist, Dr. Tracy Crane, an associate professor of medical oncology at the University of Miami Miller School of Medicine. She's co-leader of Cancer Control Research Program and director of Lifestyle Medicine and Digital Health for Survivorship at Sylvester. Dr. Crane's research interests are focused on cancer prevention and control across the continuum. Her work as a behavioral scientist has focused largely on designing, testing, and implementing lifestyle interventions that promote these healthy behaviors. And Dr. Crane's mission is to contribute to the science of behavior change research for cancer prevention and control. And that includes diet and physical activity interventions, the design of new interventions that integrate symptom management with lifestyle behaviors, and the integration of novel digital measures and e-health technologies to promote adherence to healthy lifestyle behaviors and to reduce health disparities. Please join me in welcoming Dr. Crane. It's all yours, Doc.
Thank you very much for that warm introduction. I had to learn how to get off mute. You would think after 3 years in COVID, we would know how to do the Zoom. So thank you for having me here tonight. It's my pleasure to do this presentation with Dr. Calfa, who is a fantastic physician and I've had the pleasure to work with over the last year. Okay, so opportunities for prevention. So I'm going to really focus on lifestyle factors. That's what my work is in. It says prevention, but really prevention to me spans everything from prevention, from primary prevention all the way to secondary and tertiary prevention. So I believe everybody can take something away from this talk, no matter where you are in the cancer continuum. So lifestyle factors, why do I focus on this? The reason I focus on this is because we know, if you look at this chart, these are all the different risk factors for cancer. And I've highlighted here the ones that are modifiable, things that we focus on, being alcohol, overweight or obesity, physical inactivity, and diet. And we know together that these account for more than 30% of all of our primary cancers, and about 50% of our cancer-related deaths are attributable to these factors. So the good news is these are things we have control over every day. And so in the United States, we know that you look around, we know that unfortunately, people are heavier, overweight or obese, and about 80% are not meeting the physical activity guidelines. And unfortunately, our cancer patients need help, and our cancer survivors in meeting these guidelines as well. And Dr. Calfa kind of already introduced this, but as we look at this growing number of survivors in the United States, pretty soon we're going to have over 26 million cancer survivors, which is great. This is fantastic. It means our treatment is working, but we need to be able to help survivors live their best life possible after treatment. And so the ACS guidelines, I was fortunate recently, we updated these guidelines, and I was on the panel that updated these guidelines. And when we update guidelines, it's important to know that we're going to the best evidence we have out there. That means we review all the literature related to cancer survivorship. So after a diagnosis, what kind of research has been done that actually demonstrates a survival benefit in the sciences of nutrition and physical activity. And so here's what we saw and what we came up with. So nutrition and physical activity, the assessment really needs to start at the beginning. And Sylvester is fantastic because we have a large team of registered dietitians on staff. We have actually, I think, 7 now. That's unheard of at cancer centers across the country. So we have a wealth of nutrition information. And we also have physical activity experts that are available to our patients. And so the assessment and counseling needs to start at the time of diagnosis. And then recommendations that we are making is to improve long-term health and increase the likelihood of survival. These include avoiding obesity, maintaining muscle mass. So this is new. We didn't have this before, but we are learning so much more that body composition matters. And I'm going to show you in a few slides later how we tie all this in. Engaging in regular physical activity. And this doesn't mean you have to train for a marathon. It doesn't mean you need to be hiking Mount Kilimanjaro. It means getting active every day in some capacity. But we are understanding better that we used to reserve really exercise recommendations for after treatment. And now we're really dialing it back and better understanding how exercise and diet can be used in conjunction with traditional medicine, and nutrition and exercise can serve as medicine themselves. And so following a healthy eating pattern that meets nutrient needs and is consistent with recommendations for chronic diseases, and then following the general advice for diet and physical activity for cancer prevention. So it's important to know that this is related to survivorship specifically, but we also have prevention guidelines. And so here are the ACS guidelines for prevention. Achieve and maintain a healthy weight throughout life. be physically active. So this really means 150 to 300 minutes of moderate to vigorous physical activity every week. This can be broken down into 75 minutes of vigorous or 150 minutes of moderate intensity. Follow a healthy eating pattern across all ages, high in diets of fruits, vegetables, whole grains, limit red and processed meats, sugar sweetened beverages, highly processed foods and refined grains. And really, we now know that it's really best not to drink alcohol. We used to say in moderate amounts, but now we are really saying you should be avoiding alcohol for prevention purposes. So where does this leave us? I like to put this up on screen because you're not alone if it's confusing. What does it mean to eat healthy? So we know these are titles that I've pulled from the headlines. Coffee prevents liver cancer. Soy reduces hormone-related cancer risk. BMI, or not so much. Vitamin C enhances cancer therapy. The list goes on and on. Eat less fat. I'm sure you could add to this list of all the different titles and headlines that you see in the news. So what is a person to do to really lower their cancer risk and to improve survival over time? And so when I think about diet, this quote comes from Michael Pollan. It's one of my favorite quotes. And if you remember nothing else tonight, this is one of the things I hope you remember, that we really want you to be eating food, not too much of it, and mostly plants. This is the best takeaway advice for quick. So I want to dive in a little bit into some very specific research examples that I've done over the years. So carotenoids in breast cancer. So we know that carotenoids act as an antioxidant. These are what give vegetables and fruits their orange, their red, and their yellow pigments. And intake from food specifically has been associated with lower cancer risk. However, when we think about dietary supplements, this is a whole nother risk factor that we think about because supplements are unregulated. And in fact, when we did a study about 2 decades ago in lung cancer patients where we thought if we supplemented them with vitamin A, which is a carotenoid, we thought that maybe that we actually saw that it would increase their risk of lung cancer in smokers. So in this particular trial, this was in 1,500 breast cancer survivors, and I understand this is a lot of science, sciencey looking tables here, but really what we did is we looked at women who were enrolled in this trial. Our primary outcome, or what we were hoping to test, is that these women would not have a recurrence of breast cancer. And what you see here, these are the carotenoids. So in your blood, we can pick up these carotenoids and we can see how many of them you're actually eating and consuming on a regular basis. And if you see here, the Q just stands for quartile. And you can see the highest quartile here has the lowest number. And what that translates to is that women who were in the highest quartile for carotenoids in their blood, they had a 43% risk of having their breast cancer recur. This is powerful. This is in our everyday food. So we set out, we thought, okay, this is great news. We need to figure out what does this really mean in your everyday life? We then went on to do something what we called the carrot juice study. And the objective of this was to try to, we gave participants, this is the actual bags here of carrots. There was a juicer we gave them. You can see here that there's a little bottle of olive oil. This is because carotenoids are fat soluble. And to get the most absorption, you want to have a little bit of fat with it. Not a lot, but a little bit. And what we were trying to determine is if we gave people 8 ounces of fresh carrot juice every day, would that significantly increase their total carotenoid levels and reduce recurrent risk for cancer? This is a randomized design. We had a 3-week feeding trial. So for 3 straight weeks, they drank this 8 ounces of fresh carrot juice every day. There was a secondary study part of this, which was looking at this purple carrot. We were looking at anthocyanins, which is the purple pigment in fruits and vegetables. And we thought we would compare the 2 different ones. The good news is when we looked, it didn't matter which group the participants were in. The dotted line here, the blue dotted line, shows the protective level that first study I showed you, women needed to get at to be in that 4th quartile. And what you can see is that after 4 weeks, or 3 weeks actually, from week 4 to week 7, we gave them either orange or purple carrots. You can see we exceeded that threshold of that protective effect. So do you need to, am I saying you need to drink carrot juice every day? Not necessarily, but should you include orange and yellow and red vegetables in your diet as part of a healthy diet pattern? Absolutely. I think this is good demonstration that whole foods themselves are quite protective. Another vegetable that's known for reducing cancer risk is cruciferous vegetables. And in that same study we looked at, that we did the original carrot, looking at the carotenoids in the blood, we also looked at cruciferous vegetable intake. And what we found was in those women who were again in the highest level of cruciferous vegetable intake, which is things like Brussels sprouts, cabbage, broccoli, anything that like a kale, anything that has kind of that smell when you cook it, that kind of sulfur kind of smell, those are cruciferous vegetables. And what we found is that when they were taking tamoxifen, in addition to eating this higher level of cruciferous vegetable, they had a 52% reduced risk of the breast cancer recurring. And what's important here is that, you know, these are things that we can think about when we think about chemo prevention, or, you know, things that if you're taking tamoxifen, maybe we should be recommending that you also increase your, you know, intake of cruciferous vegetables as well. Importantly, though, when you look here, this is the actual protective enzyme in cruciferous vegetables. It's over here on the right. It's called isothiocyanates. Don't expect you to remember that. What I do want you to take away from this is that this is glucosinolates. This is what it starts out in when you ingest it in your body. Myrosinase is an enzyme that is actually inside those plant cells. The reason I say this is that you need to lightly steam or cook your cruciferous vegetables to get the maximum effect, because to get that myrosinase out of the plant cells, you need to be able to break it down. And so lightly steaming it releases it, and it allows you to have the maximum absorption of these isothiocyanates. I just want to leave this slide here that seeking variety. Variety is important. You've probably all heard eat by the rainbow. It really does matter. And the reason is there's all these amazing compounds in fresh fruits and vegetables and whole grains that you really can't isolate into a pill and really get the maximum benefit. So if you're, again, second takeaway point, be thinking about eating all colors of the rainbow as much as possible. So alcohol and cancer, this is usually where people don't like me to have my talk go, but really avoidance is the guideline. We know that alcohol is an immunosuppressant. We know it's clinically relevant and it increases your inflammatory levels. We know it causes DNA damage. Also, alcohol, unfortunately, it's very high in calories and very low in nutrients. When your body sees alcohol in your body, it recognizes it more like a fat. So for example, when you consume carbohydrates, your body breaks that down at about 4 calories per gram. Protein, the same, 4 calories per gram. Fat is around 9 calories per gram, and alcohol is at 7 calories per gram. So your body it's very nutrient dense, and you can get quite a few calories in a very small amount. We also know it may contribute to folate insufficiency, and we don't know for sure, but this could also be playing a role in risk. And then, you know, when I give these talks to college students and things, and where we say, you know, avoidance or limiting it to 1 drink per woman or 2 drinks for men, I always tell them binge drinking, you can't save them all up and then have them all on the weekend. So really we want to have a reduced amount overall. None is best, but if you're going to consume alcohol, a low amount is recommended. So sugar feeding cancer, this is one of the big questions I get asked. I can go to any kind of function, and this is one of the #1 questions I'll get asked. We know that all cells in our body use glucose. And when we think about this sugar feeding cancer story, we're really talking about added sugars. We know that high insulin and glucose metabolism, when it becomes dysregulated, we know that this may prevent cancer growth. The natural sugars that you're finding in foods is likely not the culprit here. It's really the added sugar. So learn to read your food labels. When you look at the food label now, it actually says added sugars. You need to be reducing that. When you look on your list of ingredients, if high fructose corn syrup or some sort of sugar is high on that list, they have to list ingredients in the amount that they're in. And so if it's higher, that means there's more of it. And artificial sweeteners, but definitely that is not the answer either. So be aware of those. Another question that I commonly get asked is organic versus non-organic. So the nice thing is out there is that I have the website here on the bottom, but you can search every year for the top pesticide consuming food. So people ask if I can't, you know, organic's expensive. It's getting very costly now to buy organic. Do I need to buy everything organic? No, not necessarily. Maybe choose wisely. These tend to be your top, you know, pesticide, you know, foods that have pesticides on them. You also can reduce your risk, right? You can wash your vegetables and your fruit. You can soak them, you can scrub them, you can peel them. So when you're choosing what vegetables to buy organic to save money, anything with a skin you're going to peel off, you're automatically going to remove quite a bit of those pesticides. But you want to be breaking that surface tension on the fruit or vegetable in order to get the pesticides off. We know that actually when we compare an organic vegetable to a non-organic vegetable, when we look at the nutrients, we actually don't see any nutritional benefit. It is a higher cost, but it is improving. but we really want to make sure that you're eating your fruits and vegetables. That's the bottom line. Frozen, fresh, canned, even just if they watch for sodium. But the important thing is to be eating your fruits and vegetables. So what does healthy eating look like? Here you can see here, when I look at an overall diet pattern, this is what I recommend. I think the Mediterranean diet, maybe minus the wine too much, but the Mediterranean diet pattern has really had the strongest association for cancer prevention, both primary and secondary. And off the cuff, this is the #1 diet I tend to recommend. It's really got this baseline of being physically active, being with your family members and those you love. Eating should be an enjoyable experience. Fruits and vegetables and whole grains predominantly. And this is really a nice overall clean eating pattern. I'm going to shift quickly to what does it take for exercise. I just think this is pretty funny. So the doctor said he needed more activity, so you hid the remote. I apologize if there's any men that find this offensive, but I think the important thing is what is the best activity? And at the end of the day, it's the one you will do. You want to be moderately physically active. This just means 30 minutes of a brisk walk. Aim for 60 minutes or more. If you can split the doses up. You don't have to do it all at once. Vigorous activity, we are finding, may have some benefits if you get your heart rate to 60 to 80% of its max. If you don't know what that is, we do have great exercise physiologists at the Cancer Center that can help you. Resistance is important as well. Another thing is that people ask is that I'm heavy, it's really tough to lose weight. Is it really going to matter if I eat a high diet of vegetables and fruit and exercise more? This is looking at a study when we see on the bottom here, low vegetables and fruit, low physical activity. You can see the different categories. And the light purple shows people who were normal weight, and the dark purple is showing people who were heavier or obese. And what you see is, even if you were obese or heavy, if you were consuming a diet high in fruits and vegetables and high more active, it was protective for overall mortality. And so I think this is important because it means every little step matters and it's helpful towards living a healthier lifestyle. I like to show this too, adherence to diet. The adherence to the diet predicts success, not the diet itself. These are different commonly done diets over time. And when we look at people who maintain the weight loss, different diets, everybody lost initially and then had kind of a rebound. But those who maintained any one of these diet patterns kept it off. So the important thing is to stick to some kind of diet pattern. Some are healthier than others, but there is no one magic bullet, so to speak. Again, with exercise, we look here, once weight loss has occurred, it's important to be physically active. We know that the majority of weight loss is 80% of it is diet and 20% of it is exercise. After you've gotten the weight off, that sort of flips. 80% to really keep the weight off, you need to be physically active. And dosing matters. So you can see here over time, those who were in the highest quartiles were in the 300 minutes per week were able to keep it off the best. Body composition, I mentioned it earlier, that body composition matters, that we now know that it's not just about your underlying body weight, your body number. We know that lean mass is muscles, bone, connective tissue. Fat mass is important though. But this is another takeaway. When you look at two women side by side, this is a cross-sectional scan of them. And you can see here, this is looking at their abdominal area. So this is the spine, this is the front. If you had a belly button looking down on them, this would be the belly button. These two women have the exact same BMI of 29, but their body composition is very, very different. So you can see here, the blue is a subcutaneous adipose tissue, the red is the muscle. These two women are very different. So moving beyond just getting caught up in this number on the scale, I think is important. Try to increase resistance, being flexible, and an overall pattern of healthy exercise. So how do you promote a healthy weight? Learn to read a food label. Tracking can be very helpful. It's the #1 thing we do to try to help people change their diet is just be aware of what you're eating. Control your portions and seek help. Tell others you're trying to make these changes. They can be your best advocate and help you. They may also want to help, do it with you and engage in more activity and eating healthier. Self-monitoring, there's all kinds of free trackers out there. You may have a Fitbit, you may have an Apple Watch. Use these things. Your phone itself has a pedometer on it. So even just activating the pedometer inside your cell phone can give you a lot of good information about where you're at. So a long-term goal, mine actually at the end of my career, I will consider myself successful if every patient is given a prescription for a healthy lifestyle with diet and physical activity the minute they walk through that door at Sylvester, or any cancer center for that matter. so that we know we can optimize outcomes and quality of life. So read labels, write down what you eat, walk daily, move your body. But I think most important is to still remember to enjoy life. You know, you can't get too caught up in this, and eat good foods, mostly plants, move your body. And with that, I will stop and take questions.
Thank you, Dr. Crane. I think the sound of people putting their wine glasses down may have been deafening, but fascinating. And thank you, Dr. Calfa, for monitoring the Q&A section, because I saw a lot of questions coming in and you took care of answering them. And some of them we might repeat because they were important. But let's go right to our first question. So this person says, I'm having some other health issues because of my cancer treatment, such as depression, high cholesterol, and diabetes that I never had before. Is that normal? And I know, Dr. Calfa, that was on one of your slides, so I think you should address this.
So number one, the person ages and comorbidities usually tend to happen. And what you haven't had a few years ago, you can now have them because of genetics, because of different habits, because of weight gain and other things that are happening. But there is also some medication that are directly causing diabetes, high cholesterol, high blood pressure, increased weight. And that's where it feels almost cruel to say to someone, hey, I'm going to give you this pill to try to reduce the risk of breast cancer by about 50%, when I'm almost guaranteeing that that person, unless she changes or he changes what he or she does, it will have all these problems that come with that. And I think it's a vicious cycle. And I think it fits into depression and anxiety. You're told, lose weight, exercise, keep your cholesterol down, watch out for the cardiovascular risk. And then at the same time, the treatment you're taking to treat cancer, it's actually causing the opposite. So is it common to see those things happening? I would say it's not uncommon. And I think that's where this services that we're creating are really trying to break that vicious cycle. And even though it's so discouraging, I think one thing that you could do is follow Dr. Crane's advice. And we have, if you can't do it by yourself, we actually have support groups and we have mentors that a survivor becomes a coach, and they share everything they've gone through and all the things that help them to get to where they are. But our exercise physiologists, they have classes on Zoom, and we have 5 days a week the opportunity of doing either 1 o'clock or 4 o'clock with a specialist. So to answer the question, it's not uncommon to see those things creeping up, and they just feed into anxiety and depression. But with the services that we created, most of the patients are actually able to manage all of those problems, or most of them. Sometimes you need to add a medication, but the lifestyle intervention and working with a group of specialists focused on those problems will help you to control them or maybe get rid of them completely.
And I think sometimes it's comforting just to know you're not alone, that this is a common thing and that others are sharing in it.
Yeah, and we shouldn't minimize it. And I think one thing that survivors have felt left alone was that they were completing the active portion of the treatment, and everybody expects you to go back and be the mom and the wife and the sister and everything else, or the man for that same. And you're not the same, and you're struggling. And I think that's one big message is don't struggle alone. There are ways to really get help in so many ways. Many of the questions were, I'm struggling, should I try to tough it out by myself? And I don't think anybody should try to tough it out by themselves. That's why we have this huge program that you actually can feel welcome. And we want to normalize all these symptoms and all these problems that you're facing. They are there. And the cancer and the cancer treatment is causing all of those. So you're not making up stuff. You're grateful. You should not accept your new norm. And we're here to help you to really be the best you can be.
This next question, I think, is perfect for Dr. Crane. Again, it was part of your presentation, but I think it bears repeating how the lifestyle changes and moderations can really make a difference. This person asks, after I finish all the treatment and am cancer-free, what are the fundamental factors to prevent the cancer from recurring? Having a good diet, the types of food, organic, no meat, and avoiding stress.
Yeah, so I think all of those are very important, right? And hopefully the takeaway here is that you're eating a mostly predominantly plant-based diet. That doesn't mean you have to be a vegetarian, right? Protein is important. I showed that body composition slide. Part of how we build lean mass is making sure that we have adequate amounts of protein. So although I think a plant-based diet is important, It doesn't mean that meat is the enemy. It just means that red meat, processed meat, you want to be consuming in smaller amounts. But I do think the base of the best cancer preventive diet you can have should be whole grains, vegetables, and fruit.
Okay.
Can I add something to that, Ileana? Can I just add
course.
one thing? Because it wasn't part of the conversation, but I think in secondary prevention, even primary prevention, there's now moving toward from just testing genetically individuals that were felt to be at very high risk because of loaded family history stories. We're moving towards testing almost everyone that was diagnosed with a solid tumor. And that's a new tendency and recommendation that are as early as February and April of this year. And we really want to identify those that have a genetic predisposition for cancer. That could explain the first cancer they have had, but it will also make a difference in the way that they care for themselves and their families in terms of secondary prevention and prevention of other cancers from happening. So knowing your genes, it's really important. And we have programs at Sylvester. Some of them are about to be launched, so I'll keep that secret for now. But talk to your doctor and say, hey, I would like to really talk about genetic testing and look again. I know the old criteria have changed. Can I have genetic testing now? Because that will modify the risk for developing secondary and additional cancers as the person lives longer.
I'm going to challenge both of our experts now to do as quickly as you can and to get these questions in if we can, like with quick responses, because we're running out of time. It's been incredible. But this question is, my husband survived prostate cancer, but after the radiation treatments, which ended 9 months ago, he has a lot of stomach problems and feels very tired. Give me a quick response to that.
So I mean, really quickly for me, I would say, I think it's normal after treatment to have these feelings of stomach being too full too quickly. I think one thing you can do is try to eat the most nutrient things first. I also think even though you're tired and maybe not feeling as well, getting a little tiny bit of exercise, going outside can be helpful. And then I'll let Dr. Calfa answer more.
You said it. You're good.
Okay, so here's one, Dr. Calfa, that I think is important. What are the most serious symptoms to investigate? I think sometimes we're thinking, is it in my head? Is it stress? What is it? Real quickly.
People ask that question because they want the reassurance that the cancer is not back. That's the number one, because of that fear of recurrence, right? So I tell my patients, give it 2 weeks and also ask yourself, can I explain the symptom otherwise? So people get kidney stones and they're going to have back pain. They pull a muscle and they're going to have back pain. That it's not equal to cancer recurrence, but that's what comes in mind. So I also tell the patients, if it comes and goes, it's probably not cancer related. But if it's something severe that you would go to the emergency room otherwise, then, make sure you reach out to your doctor and you pay attention to that.
Here's one that's very key. Do you recommend transflap reconstruction?
That's an individual's decision. Not everybody is built for a transflap. That means it's an autologous transfer of fat from a part of the body to the chest to replace the breast. So it depends on the body habitus and what's best for that patient. That recommendation comes from most expert plastic surgeons. I will discuss that, on an individual based cases.
And like we've said to the audience all night, please reach out individually in the question and answer section so that these physicians can, reach out to you later. And also there's going to be a video of this afterwards that you're going to receive, all you registrants. I think this is a perfect question to end on for both of you to weigh in on. Will I be a cancer patient for the rest of my life? Both our experts, please.
You'll be a survivor for the rest of your life. I don't even call people that have cancer a cancer patient. I just don't think we should label anyone like that. But just like if someone had blood pressure, you had blood pressure is in your medical history. If you had cancer, you're a cancer survivor, and you should celebrate every minute of it.
Yeah, I agree. I think that you are a survivor. I think Dr. Calfa is right. It doesn't define who you are, though. It's just something in your history.
Mm-hmm. And I know, Dr. Calfa, you answered one question directly to a patient asking whether insurance covers these cancer survivorship programs. Could you just give us a quick response on that? I think everyone's interested in that.
We're super grateful for all the philanthropy that, support our mission at Sylvester, and all these services are provided at no cost. There's acupuncture that has a minimal cost associated with it. And insurances most of the time don't cover that acupuncture, but everything else I share with you is really free of any charge at Sylvester.
Okay. A quick wrap up from each of you, just some words of wisdom from the heart and from your expertise to share with our audience tonight. You know, more than 100 people after a storm that threatened us all week are joining us tonight. So that's something to be said. Go ahead.
You want to start, Tracy? Or you want me
Yeah, I mean, I just think that, you know, the fact that you all showed up here means that you're trying. And I think trying to find answers, advocating for yourself and doing the best you can is part of the journey, and you can do it. I mean, hopefully you see that there are support services that are Sylvester, and that a lot of these things you can start small and build, and they do make a difference.
I agree. And I just want you to know that no one has a guaranteed tomorrow. So we're all in this together, we really are. And just the fact that you had the diagnosis of cancer, I have seen so many stories where things change abruptly for people that never had cancer. So that fear of recurrence, try to just accept the fact that you, like anyone else, has some risk in life, and just live your life at the fullest.
Well, thank you to our experts. I mean, you know, we deeply appreciate the time and the important information you've shared with our audience tonight. Dr. Carmen Calfa, Dr. Tracy Crane, you know how to reach them. We're going to give you more information as to how to reach them at Sylvester Comprehensive Cancer Center. We want to thank you, our interactive, very engaged audience, for your participation, because I want you to know that the University of Miami Health System appreciates your participation. We want you to visit sylvester.org/survivorship for more info. Or call 1-844-324-HOPE. And you can call to learn more, make an appointment with our experts. They're happy to see you all. Hope you enjoyed it. Tonight is the Miami Dolphins game against the Cincinnati Bengals. So I hope that you'll be able to participate with us in the future and fill out the survey at the end so that you can suggest some topics in the future. Have a great night, everyone. Please stay safe.
Thank you, everyone.
Thank you.